Okay, this is Jack Halls. The date is May 12th, and it is 4:01 p.m. Can I get you to say your name, please?
My name is Kasie Myers.
Um, do you mind sharing some demographic information, like your race, ethnicity, age, and gender?
Yeah, so I am a white. I live in Eau Claire, Wisconsin. I'm 32 years old and female.
And what are the primary things that you do on a day-to-day basis? Like, what's your job, extracurricular activities, stuff like
Yeah, my job title right now is a registered nurse. I'm currently enrolled for my master's program to be a family nurse practitioner. I work strictly weekends right now, 12-hour overnight shifts, Friday, Saturday, Sunday. And then Monday through Friday, I'm with my 6 and 4-year-old, and we play outside as much as we can right now and go hiking a bit.
Sure. And when you first learned about the pandemic, what were your thoughts, and have they changed since then?
Yeah, so when I first started hearing about it, um, my first intuition about it was that it seemed a bit crazy to me. Um, I typically work in a cardiac unit, sometimes intensive care. I was handling fresh post-op cardiac surgeries. Within about 2 to 3 weeks of hearing about the COVID, we started taking as many precautions as we did. The first standpoint from the hospital's point of view was kind of panic. They thought we were going to be running out of PPE. So we were taking very, I would say, cautious actions to not run out of that PPE. I started working strictly on COVID rule out and COVID positive units. At this point still, so for the past 6 weeks, I have been dealing with the COVID rule out and COVID positive patients that are more stable and what we would call, so not on ventilation or not intubated at that point. We started only being allowed to wear masks without getting a new one. They were asking us to wear the same mask for at least 3 days, unless it was heavily soiled or ripped at that point, which it becomes very not comfortable to do that. We did that for about a month, and then now we're able to wear a mask every single day, wear a new one. So getting back to the question exactly, I thought it was very outrageous when the first steps that we started taking. For about a month, we saw nothing happen within the hospitals. A lot of people from the panic were coming in and asking for COVID rule out, COVID testing right away. And we were kind of wondering when this was going to go. They keep on telling us that the height and the peak is going to be this, is going to be this. Well, we haven't seen that peak yet. They keep on pushing it out for about 2 weeks. From the hospital standpoint, I've seen very stable patients just needing a little bit of oxygen, but we are monitoring them due to how fast we have seen COVID progress in a person. So still right now, I'm still kind of waiting for the very bad to come from it, I guess. And if that answers the question, or if I can.
Yeah, I'm sure we'll get into it a lot more through this.
Yeah.
So what issues have you most concerned right now about COVID-19?
So right now, going to work and then, the safety of my kids primarily. Um, from my education and what I see, it's mostly affecting the persons of lessened immunity. So their bodies are persons more at risk are persons not allowed or not able to fight off viruses as well as a healthy person. So right now it's personally impacting, like I don't want to affect my parents or I don't want to affect my kids because I'm a single parent. So my parents help out a lot with childcare. So personally, I go to work in my own clothes. I get to work, I go into a locker room, I put on from head to toe a hair protectant, surgical scrubs, and I wear shoes that do not leave the hospital. We don't bring anything into the units at all. Anything that is personally mine, when I get off of the unit, I wipe it down with a bleach wipe. And then I go into a contained area. I take off everything that I wore into the unit, and then I shower at work. Um, and then it's a designated area as well that after I'm all cleaned and shower, I put on everything that I brought from home that never even went into the COVID unit. So and then again, dependent on how I feel when I get home, I shower again right when I get at home without touching my babies or anything. So, yeah.
In what other ways has it affected your job?
So at first, it's kind of scary. At first, I didn't know if, well, at first, when we first heard about it, um, they were asking me, I'm a 36-hour a week position. They wanted me, or they were only going to have my position if I agreed to work 48 hours. So this is at the very beginning of the COVID. So they were again preparing for, it to be way worse than it is at this point. So they wanted me to do a summer position working 48 hours a week. So I would work 4 12-hour shifts a week. Our 12-hour shifts normally turn into 13 hours with report. So at first I thought I was going to have to work like every single day, basically. And then I would say it probably took about a month's time uh, to realize that they didn't need that overstaffing. So now we're getting to the point now where I'm working my 36 hours a week, but it's gone back and forth to where I thought I was going to lose my job because my personal hospital is very much so overstaffed. So where some positions have opted into optional furlough, into they're giving up one shift a week, or they're giving up their whole position and doing PTO, the paid time off, or they're collecting the unemployment of furlough. Um, every shift I would say that I work, most typically weekends in the medical field are the area where we need most people and most help. Every weekend for the past month, I would say, is we're very much so overstaffed. So now I'm back to the point of just this past weekend, I was like, am I gonna have my full-time position,
Sure.
So
And what other ways has it affected the employment of other people that you know?
so it's definitely different everywhere you go, what you do. I have a lot of friends that are nurses. Um, Most of them have opted into furloughing one shift a week, which means if they have the 3 shifts a week, they are only working 2 shifts a week. It's their choice to take PTO for that 12-hour shift, or if they take the furlough for that shift, they can collect unemployment for those hours. Um, I have known probably a handful of people that have lost their position completely. Um, they were called, I would say they were given a 24-hour notice, and they said you are off the schedule until further notice. Um, they're collecting unemployment, and I know those people have been in that position for at least a month. And then I also know some nurses in different facilities that they have also prepared themselves for the rush of COVID to come through, and just to make sure they have that staffing if or when we need it. And there has been, what do you call it, bonus programs within different facilities saying, so if a nurse is in a full-time position, so that means 36 hours a week, they have designated an 8-week period to where they'll work a shift or 2 extra. So not only are they getting the bonus of however many hours they're working for that specific program, but they're also going to be getting paid the bonus amount for working overtime within that week. Now, again, if they're not needed, they can get called off for that time frame, but those facilities are preparing for the so-called rush of the COVID patients that they're saying that we're going to be anticipating.
How has COVID-19 affected you and your family in your day-to-day activities outside of work?
Yeah, so I mean, at first it was a huge, I guess something to get used to, when as a single parent, I have a very, very strict schedule. So Monday through Friday, I know that my one child is going to be in school. I'm also in school. So it greatly affected us just because I have them in school and so many activities. So at first, it was very challenging to get used to the schedule changes. Then, just giving them something to do within that realm. Now, since with the weather's getting nice out, I don't think it has impacted us as much as how busy we're staying as a family, but I'm not so being as strict as I should with following along with the itineraries as far as the school that they're giving us. And I'm more giving them like, let's go hiking and let's learn to ride our bike better. Or, we've been doing tons of landscaping and just spending more time as a family. And it's very much so enjoyable now, but we're making the best of the situation. So we're steering away from the education aspect of it, but still keeping it a little part in their lives because I know that the kids need that. As of right now, from a standpoint, I've had my kids in swimming lessons and soccer and t-ball, usually within the summer, and I don't think that's going to be happening. But I'm giving them different things to look forward to right now.
And how has it affected how you associate and how you communicate with friends and family?
Yeah, association, it was tough because, when we do get our free time that we can spend with friends, at first I think it seemed like we were more complaining because we weren't able to get that interaction. But most definitely been FaceTiming more. We've been having a lot more conversations with family, with friends. So yeah, I think that really is impactful on the relationship, that we hold close, as families. I have a brother, sister-in-law, and a nephew that live in Arizona, and I haven't seen them forever, and I was going down to visit them a lot, but I've not seen them for almost 3 months
Yeah. What are some of the other big challenges that you faced during the outbreaks?
now. I think a huge challenge is, the daycare, the important education and structure that I know kids need. As a single parent, working full time and continuing education, that's tough. Grocery shopping, that is a huge, that's something huge. I'm very, very thankful for the online shopping and the pickup, because I have no idea how I would be buying food right now. I have no idea. I kind of have to, that's like my biggest struggle, I think, is the food. I have to kind of plan out 3 or 4 days in advance what I'm going to need in 3 or 4 days, because the online booking or online shopping is so booked out in advance, and I always have to make sure that I have food here. But I think now, because of the time frame, how long I've had to accommodate to everything changing, I think we're doing okay now. And it's confusing and sad and kind of funny to be hearing from a 6-year-old's mouth, when can we go do this again? When is the virus going to be gone? So I think that was kind of weird. They kind of did educate them before school got out, why they weren't coming back to school, or when they didn't know when they were coming back. So it's kind of weird. And he just said that to me today, when's the virus going to be done so you can go and do stuff again. So yeah.
How are other people around you responding to the pandemic?
So I think more older people, which they have the concern to do so, because I'm seeing, as far as the standpoint in the hospital, that the 60 plus persons, they are more concerned, and taking more precautions, which they in their right mind should, especially, I don't know what else they have going on. My friends, so I'm 32 years old. I have a bunch of friends at this point, saying, it's too much now, not so much, if the restaurants and the bars aren't open, but the events and the restrictions on, going fishing, how many people you can have in a boat, or, a lot of the summer events that are being canceled, that I think get people through the year, because, that's when people can get out in Wisconsin, is during these good summer months. But I think a little bit of frustration is coming now. And then as far as medical professionals, I would say the majority of them believe that, we need to start getting back to our normal life. I believe that a lot of people think that, the PPE talk and running out of PPE here and all the precautions that we're taking are preparing ourselves for the COVID patients to come through like crazy, in which they anticipated. We're not getting that. So at what point can we start exposing ourselves to each other? Because we know COVID isn't going anywhere. It's going to be around for a while. So I think everybody is kind of done with everybody being overwhelmed for the most part. But I do believe that the elderly population have, more of a concern.
Sure. Have you seen people around you change their opinions since the beginning of the pandemic to now?
Yeah. There are still people that are highly opinionated, to, not leaving the house, religiously wearing the mask wherever you go, the heightened awareness of how serious this virus is. Um, I have definitely seen a heightened precaution or awareness at the beginning of it, and now those same persons saying, well, when is this going to stop? Or, when can we start exposing ourselves? And the continuing of the canceling of events. I think people are just wanting to get back to, summer living and enjoying themselves again. Um, so the original question was the changing of the views, right? Um, yeah, so I, and then I still also know people that, I have neighbors, I have specific neighbors that will not even still come out of their house, and aren't exactly of the elderly population. But I see more people wanting to socialize. Even in the yards, I see a lot more people out now than I did at the beginning. So a lot of changing of views towards it, yes.
How has it changed your relationships with family, friends, and community?
Changing of my relationships. So I have voiced my opinion on, I would say, social media accounts and, just day-to-day opinions of what I feel about what we're doing with the virus, what we need to do, the good hygiene, and, not the immediate reopening of everything. I've expressed my opinion on political views on it. So respectfully, I keep a very open mind to everybody thinking differently. There has been a lot of talk about, what's happening in the hospitals and people's personal opinions, what's happening. It has caused some frustration within relationships. However, on the opposite end of it, as far as immediate family goes, my parents, my brother, immediate family, I think it has brought a lot of together time. So that is positive. It's just the simple stuff, like me personally. I have been decluttering and making my life a lot more simple, and just knowing that being together is the only thing that matters. And it's opened my mind a lot to my relationships. And then, there's the handful of friends that, I make sure to check in all the time. So it has opened my eyes to a lot of relationships. And then it's brought in a lot of relationships closer as well.
In what ways do you think that COVID-19 has been affecting people's mental health?
So I think at the very beginning, is pretty bad. I've felt those days where, as a parent, I have just thought, I'm like, what am I gonna do? Like it's there's a lot more added stress and a lot of changing situations and schedules very fast, and we just had to adapt to them. I try to be very aware of what I need to do as my own self. So I think people are now getting to it that you need to get out, you need to be active. I run every other day, and I counted over 15 either persons or group of people being out on walks. So people that are aware what they have to do for their mental health and to keep healthy, they're doing it. I've also been told by emergency room staff that, we're seeing the continued and increased persons come in with alcohol and drug withdrawals. And I haven't really been personally involved in any situations. to say have those persons, in medical facilities increased at this time, but I would imagine very so that, people aren't doing well, they're not getting into their follow-up physicians and not allowing them to know if there's any changes, and they don't have that access right now. So I think that's kind of scary as well.
What have been your main sources of news throughout the pandemic?
So where am I turning to?
Yeah, where are you getting your news from?
Yeah, so as busy as I am, I actually try to avoid news as much as possible. I think within the weeks of, experiencing COVID and being a part of it 3 out of my 7 days of life, and, working with it one-on-one, taking care of the patients, I said, okay, I have to start educating myself on what people are seeing in the news, and, like what studies are coming out, about this COVID right now. So I had turned on ABC a couple times, and the only thing that does for me is I think it focuses on the very, very negative of COVID. I haven't seen much positivity. And then I started following Fox and CNN. And again, I think they're coming from it of a more political standpoint and how it's affecting the world right now. And then I just started following WEAU resources and kind of really how it's affecting us locally. From the medical standpoint and a medical student, I actually turned to ANA, which is the Americans Nursing Association, who, and then an IBC for more studies about how the virus is being looked at from a standpoint that viruses that have been studied for over 100 years, and how it correlates with how it's spreading, medications that are used to treat, and so I'm focusing more now on the medical research that's going into it, and when and how, if they can get a vaccination that would be therapeutic and effective.
And you're in school currently?
Yeah.
Has the way that you are attending school changed at all?
Yeah. So I was going to start, so I am through Chamberlain College of Nursing, through my master's. I was going to start clinical rotation, so practice hours for me to complete my, to graduate next May. So within this time, I was going to be starting my clinical rotation, and I was going to be attempting to do it every Tuesday, Wednesday, and Thursday. So the week after the COVID crisis has started, all clinical hours and rotations were canceled indefinitely. Persons that were graduating this May obviously, got that free time. At this standpoint right now, I should be graduating next May with my FNP, and they don't know if they're going to be pushing us out another semester because we're going to be missing so many clinical hours. 640 clinical hours are required of this, and I haven't even started them yet. So the clinical aspect is of that. And then as far as education, I have a class every 8 weeks, and we have at least 2 pretty large assignments every week that are due. So I'm going now into my second 8-week class since the COVID had started. Basically, all assignment due dates are pushed aside at this point. The only assignment due dates that we have are our midterm and our final. So we have to do it by the state, and that's it. Our other assignments that we typically have, if they're done and due by the 8 weeks, it is said that we are getting credit for those assignments just because of everything that we're dealing with either at home or if our job circumstances are changing. So they are allowing us a lot more free time, and they're being more forgiving, I guess, for our assignments.
And how do you think municipal leaders and government officials in your community have responded to the outbreak? You think they've done a good job?
Yeah, so I think within the area, they're handling it quite very well. As far as the health officials and, thanks to social media and the video, casting that we're doing, I think that's pretty cool right now, because, it seems as of every other day, they're giving us updates, exactly what our local community is looking at. So I think that aspect, they're doing pretty good. I haven't necessarily heard a lot about, the reopening, if we're going to have phase 1, phase 2, phase 3. I'm looking more updates from the educational standpoint for my kids, and then if the events are going to be canceled or not. So I think they're doing okay. I think they should make it more known exactly what our plan is, after May 26th, from this standpoint. So I think we're doing okay right now.
And what about at the federal level?
It's kind of, I think, exhausting on my point mentally. Again, I think I check in at the end of every week. I think the federal level, it gets more political and argumentative, more as in, so talking about the virus itself and how it's affecting everybody. I feel like the federal level is more looking at laws and the lawsuits that I've been hearing about, and from my standpoint, it looks like a big fight to me, instead of dealing specifically to the virus. What are we doing for the virus? What benefits are we having? Opening up at the beginning of May, opening up at the end of May, and how are we going to help the people keep the hygiene, keep the distance, So I feel like they could do a better job with just educating what we can do personally and individually, and more, get out, go for a run, kind of dealing with that instead of the argumentative standpoint that I feel that is going on right now.
Has your experience transformed how you think about your family, friends, and community in any ways?
Specifically, like to COVID or relationship?
This whole experience through the quarantine and stay-at-home orders and everything.
Yeah, and you're asking, has it changed?
Yeah, has it changed how you think about family, friends, community?
Yeah. The first thing that came to my mind was, if family and friends have different opinions about the situation, I had just asked everybody to keep a very open mind about everything that they feel. If they see an opposing view, to ask me questions, see what I'm seeing, or ask what I'm seeing in the hospital, and what they can do to better protect themselves, or just ask, even if we have opposing views. As far as my age and where I'm at with my relationships with my friends and family, it's gotten scary at times, especially working in the hospital. I'm trying my best to make them feel important. Are you still there?
Yep.
And carry on relationships, if not build on them more. I mean, my mom is one of the most important people in my lives, and I try to make that specific time for her and know that that relationship is important. And again, it's just the small things of being present in each other's lives.
And knowing what you know now, what do you think that individuals, communities, or governments need to keep in mind for the future?
So again, I think with what we need to do in the future, it's more about educating about preventative actions. Um, I think we're really focusing a lot on the numbers of COVID, and um, you know, the the more we test, the more numbers are going to come about. So we're going to see that. But I just wish that the local community, again, would take more initiative of saying we have to keep in mind the well being of our persons. And it seems like to me, since, more everything has been shut down, there's been a lot of bad stuff going on in this community. And I think we need to focus on the mental health, preventative measures, and just keep a more positive approach. And I guess from what they display to the communities, not focus 100% or not communicate the numbers of COVID right away, but how we're progressing and how we're getting better in our community. So we can talk about the positivity and, the negative things that are happening in the community, I guess.
And is there anything else that you'd like to add?
No, I don't think so. I think that's about it. Yeah.
Great. Yep. That was fantastic. Thank you so much for participating in this. I'm going to end the recording here, and then I can stay on just for a minute and explain where you can find the project.
Awesome.
Okay, thanks.